In 2020, as the world came to a halt, a group of heroes in white coats from San Francisco Chinese Hospital stood at the forefront. They risked their own lives and those of their loved ones to combat the invisible enemy, COVID-19, and protect our community.
有少少唔同嘅嗰度咧，就 on 24/7 call 嘅 7 days straight 嘅。If it was like 3 a.m. in the morning, something happened, the nurse would call us, we would have to answer. So it was really hard.
Really no one knew anything about COVID-19. So we were scared of contracting the disease and scared of bringing it home to our families.
San Francisco's Chinatown, one of the densest neighborhoods in the U.S., faced a unique threat during the pandemic. With families living in close quarters, social distancing was nearly impossible. However, Chinese Hospital stood as a beacon of hope, safeguarding the community against a potential outbreak. Dr. Jennifer Chen, who was working at the Chinese Hospital clinic, still remembers when the first patient with COVID-19 symptoms arrived at the clinic during the early days of the pandemic.
She was in her late 20s, and she came in complaining of shortness of breath. And when I listened to her lungs, I could hear audible wheezing, basically sounds that she had some type of infection going on. She went to an urgent care. She went to an ER down in San Jose. They didn't do any imaging. They didn't do any testing, but that was at the beginning of the pandemic. I could tell there was something going on. We did order a CT scan, and I found bilateral pneumonia, actually, which is very rare for a young person.
As someone who was born in Chinese Hospital, for Dr. Chen, the institution is more than just a workplace. It's where her life began. Returning to serve the community after completing her residency, she found herself on the front line of the pandemic just 4 months into her tenure.
You get to a point where you just take the risk. You come to work and you come up with a plan if you do have family, whether it's parents or siblings or children. It's like, okay, if I am exposed, what is the plan going to be?
Dr. Jessica Lee, raised in San Francisco Chinatown, she assumed the role of medical director during the crisis, and she recalls the early challenges.
Our biggest challenges was making sure that we had adequate PPE. I remember actually in the early days when we had the N95 masks, we were told to bring them back home in a brown bag and then lay them out in the sun. So one of the things that our hospital did was we implemented rigorous infection control measures. Our CEO did an amazing job. Dr. Jen Zhang did an amazing job of securing PPE for us.
Can you believe it has been 4 years now?
It was a nightmare.
Yeah.
When they were unable to quarantine in the SRO home, the hospital provided a safe haven for the recovery. In a heartwarming demonstration of community care, Chinese Hospital went above and beyond for a couple diagnosed with COVID-19, exemplifying unwavering commitment to the patient's well-being beyond conventional medical responsibilities.
There was a couple, I clearly remember, that was diagnosed with COVID. Now, because they live in the SRO, and ended up we kept them here because the city at that time couldn't find the hotel rooms for them to go to be quarantined from the family, even though the hospital didn't get paid because the patients actually at that point were not qualified for inpatient anymore. But because we're community hospitals here, we're here for the community, then we did that.
Throughout the pandemic, Chinese Hospital conducted over 40,000 tests and took significant action in the Chinatown SROs, distributing more than 210 testing kits and administering over 56,000 vaccines by the end of December 2020. Because of all of these efforts combined, they were able to prevent another huge outbreak in the community.
Our support health team did a lot of work to go out into the community to do COVID testing and provide vaccinations. Very early on, they embraced the public health guidelines of masking and social distancing and hand washing, and I think that made a big, big difference.
San Francisco Board of Supervisor Aaron Peskin supported the Chinese Hospital to combat COVID-19. He noted that the situation in Chinatown could have been much worse.
Particularly in Chinatown, which is one of the densest places in the United States, where people live in very tight quarters in facilities that had a lot of shared contact. The single resident occupancy units that many people in Chinatown live in, there are shared congregate kitchens, shared congregate bathroom facilities, and the medical experts and the elected officials were just in sheer terror that thousands and thousands of deaths. I mean, it was very, very, very scary. And actually, even as I rethink it, I start to get emotional. But the opposite happened. And it's a story that really hasn't been told.
During those most challenging times, the CEO of Chinese Hospital, Dr. Jan Zheng, and Supervisor Peskin would call each other frequently to discuss public healthcare strategies in Chinatown, knowing well that the people in the SRO desperately needed their help.
We didn't expect people to come to Chinese Hospital to get testing. We actually Chinese Hospital brought testing literally to the streets outside of this building, brought vaccinations to the streets.
And they were so afraid. They didn't dare to come out. So that's why that we delivered care to them.
The solidarity and swift action in Chinatown, led by Chinese Hospital, Supervisor Peskin, and various community organizations, showcased the power of the community in the face of adversity.
When a woman who was supposed to die through the weekend, she's alive today. The bottom line is that in the second densest place in the United States of America, the transmission rate was amongst the lowest in America. It is something that San Francisco and Chinatown should be proud of for many, many years in the future. It shows what we can do. And this wasn't done by the government. This was done by Chinese Hospital and a rich fabric of community leaders.
The roots of Chinese Hospital trace back 125 years, evolving from the Donghua Dispensary, a beacon of Eastern and Western medicine in the heart of Chinatown. Its inception was a direct response to the exclusionary practices of the time.
Chinese Hospital was established back in the 1899, and when a lot of overseas Chinese came to United States to build the railroads, sadly, when they were sick, they were not allowed to access the mainstream hospitals.
The early 1900s brought the bubonic plague to San Francisco's shores, igniting fears and leading to a quarantine of Chinatown. The community's resilience in the face of discrimination and disease laid the groundwork for the enduring spirit of Chinese Hospital.
And when this thing happened, the Chinese immediately, took notice and want to put a stop to it. Okay, but the point is, when the other part of San Francisco, all the Westerners, when they hear about it, and what happened was they immediately blocked China for quarantine.
Mr. James K. Ho, a former deputy mayor of San Francisco, has also been a board chair and vice chair of Chinese Hospital for over 30 years.
And went to court and say this is discrimination. And when the judge saw the line that they quarantined Chinatown is all zigzag and it's not straight line, and all the zigzag goes to the white people. And so the judge say, this is discrimination, obviously.
The outbreak of the bubonic plague was a pivotal moment that highlighted the indispensable role of the Donghua Dispensary, which later evolved into the Chinese Hospital, in safeguarding public health against the backdrop of political and social turmoil. This was strikingly similar to our experience during the 2020 pandemic.
So history sadly repeated itself, but the difference is that now during COVID pandemic, we are stronger as a community.
After the bubonic plague, Donghua Dispensary was destroyed in the aftermath of the Great San Francisco earthquake in 1906.
There's a fire. By then, although we have moved, but the fire burned us off.
17 years later, the Chinese Hospital Association was formed by 15 organizations to raise funds for building a new Chinese hospital facility in Chinatown.
But the good time did come is after the Second World War, because a lot of the people came back from the war, and they are getting ready to have kids.
From then on, many celebrities and community leaders were born at Chinese Hospital, including the legendary star Bruce Lee. Over the following decades, Chinese Hospital continued to expand, building new adjacent healthcare facilities to meet growing service demands. However, in the 1970s, the hospital faced another challenge and was nearly closed.
So in the 70s, all the small community hospitals faced a new requirement. Chinese hospital faced the same challenges.
The collaboration between the community and government in the 1970s marked a turning point for Chinese Hospital, securing its place as a cornerstone of healthcare in Chinatown. This unity and resilience set the stage for a groundbreaking initiative in the early 1980s, a pivotal moment in medical history. As healthcare faced new challenges, Chinese Hospital embarked on an innovative journey that would redefine community-based healthcare.
So what it is a tripartite. What is a tripartite? You know, in healthcare, there are three things most important: insurance, the doctors, and the hospital.
This integration aimed to ensure that all three components work together to reduce patients' cost.
In the 80s, and our Chinese Hospital Board of Trustees, together with the physician leaders, created what we call managed care integrated system. And so that really helped the hospital, the health plan, and the physicians, right, in the past 40 years.
Today, Chinese Hospital continues to be guided and governed by a board comprising representatives from the original 15 associations and medical staff that led the hospital. This epitomizes true community service, as board members serve voluntarily without pay, compensation, or reimbursement for any expenses. This approach maintains that the hospital's integrity and steadfastness in its mission to serve the community.
我叫蔡明群，咁我係今年93歲。
Ms. Choi Ming-Kwan has been living and working in the Chinatown community for over half a century. Her two sons moved away to another city, and she was living only with her 60-year-old daughter at that time. However, suddenly, in November of last year, her daughter fell, injured her hand, and underwent surgery at the hospital. After this surgery, it was discovered that her daughter had bone cancer.
咁佢冇話俾我聽，佢方住我擔心。
On February 9th, around Chinese New Year's, Ms. Kwan's daughter was admitted to the 6th floor of the Chinese hospital for chemotherapy. Since the medical staff all speak Chinese, it provided significant comfort to Ms. Kwan and her daughter during this challenging period.
職員同埋護士都係好有愛心、好耐心。咁甚至我女，我覺得佢好沉重，我話我可唔可以喺度陪佢啊？咁佢話好，咁你喺度陪佢，我哋俾一張椅拉開嚟係床俾你咁樣，咁你比較舒服啲，咁唔使咁坐喺張凳度咁同時咧到餐期嘅時候，佢你唔好出去啦，我哋叫多一個餐俾你啦咁。
Unfortunately, her daughter passed away on February 21st. Despite this, the hospital staff continued to reach out to Grandma Kwan, ensuring her well-being.
咁佢哋能夠即係喺身邊話俾你聽，而家係咁嘅情況，唔可以挽救，而就係應該我咁老啦，你都應該係需要點樣面對自己以後嘅生活。
The emotional support provided by the Chinese hospital staff helped Ms. Kwan navigate the traumatic loss of her daughter. They made her realize that it wasn't the end of the world, that she still had a path to follow in her life, with the Chinese hospital there to support her every step of the way.
因為咧癌症咧係好可怕嘅病。
Mr. Arthur Chan, the honorary president of the America DHU Business Association, has been recognized as the top donor of Chinese hospital. In fact, his very first donation to the Chinese hospital was earmarked for the cancer center.
我太太、我爸爸、我哥哥、妹妹、我個 manager、我個 truck driver。全部染咗癌症，所以我咧就想建立一個癌症中心嚟到幫人咧，就醫治同埋預防呢個癌症，係咪？同埋幫助嗰啲低收入嘅人可以解決佢哋嘅經濟問題。
Mr. Chen recently underwent surgery and chose Chinese hospital to receive care.
東華醫院服務相當好，佢哋嗰啲人咧好細心，好關心。
Before 2024, Mr. Chen had already donated over $4 million to the Chinese hospital.
今年咧就125週年，我就預備捐125萬嚟幫助佢哋，支持佢哋。
我係12年上埠嚟到美國啦，咁第一時間就係嚟咗華埠啦，所以個華埠俾我感覺就係好親切啦。咁我第一個了解咧就係東華醫院啦。
Chun Huang-Woon's parents are currently under the care of Chinese hospital.
佢哋有咩唔舒服啊？佢哋可以第一時間嚟到呢度，咁就算我唔同佢哋嚟急診個情況下咧，佢哋自己都可以明白個醫生同埋護士講啲咩俾佢聽。
Her daughter and she were also able to receive care from Chinese hospital. There was one time when her daughter had a fever, and Chun Huang was so worried that she took her to the emergency room of Chinese hospital.
我第一時間我唔理咁多，我就帶咗佢嚟呢度啦。咁嗰時我先開始知道，原來你哋個急診係冇兒科嘅喎，係得個成人科喎。咁其實個護士同埋醫生都好好，都幫咗我同佢去退咗燒啦，幫佢搞掂晒佢啲唔舒服啦，都係個零兩個鐘咁都可以返屋企啦。
After a while, I took her out and put her in Chinese hospital, and she was very happy.
James said the Chinese hospital is always close to his heart because his grandmother received care there. Initially, he had sent his grandmother to UC Hospital, but she was not happy at all there.
One day, she asked me to come to her bedside, and she said, well, grandson, if you can help this hospital, it will be fantastic. I say, I will do that.
2024 marks a significant milestone for Chinese Hospital as it celebrates its 125th anniversary. In addition to the commitment to delivering the best possible services, Chinese Hospital is dedicated to updating its facilities and technologies. Their efforts have been recognized nationally as well.
A lot of new technologies was built in. For example, and we can turn the entire floor into negative pressure.
In 2016, the patient tower replaced the original hospital equipped with advanced medical facility. The new patient tower boasts 88 beds, a state-of-the-art diagnostic imaging department, cardiopulmonary outpatient services, 4 surgical suites, all private ICU beds, and a telemetry unit. Additionally, the new building houses East-West Medicine Services, a pharmacy.
So if needed during the pandemic, we could have used the entire floor for COVID patients with the negative pressure.
The Chinese Hospital Emergency Department, licensed as a basic emergency medical service, serves as the central hub of emergency response for the Chinatown and North Beach neighborhoods. The old 1979 structure still needed renovation. This renovation aims to modernize and enhance the hospital's infrastructure, ensuring operational efficiency, functionality, and patient safety.
For our board of trustees to build this new hospital, it was very challenging. We actually had to borrow $65 million in addition to the over $100 million from operational surplus and $35 million raised by our fund development committee, which was led by Rose Peck.
Healthcare has changed significantly in the United States in recent years, particularly after the pandemic. Dr. Zhang believes that building partnerships is crucial, especially amid a shortage of physicians and healthcare professionals.
And then we also established a primary stroke center in collaboration with UCSF so we could provide stroke care to our patients. And this is a great partnership in a way that now our Chinese-speaking patients can come to Chinese hospital, speak their own languages, and then access specialty care provided by UCSF specialists.
The patient demographics at Chinese Hospital consists of approximately 65% individuals age 60 and above, with 80% benefiting from Medicare, Medi-Cal, indicating a significant portion of low-income patients.
So Chinese Hospital established outpatient clinics in Sunset, Excelsior, Daly City, based on our community's needs. That's how Chinese Hospital create our programs.
As the only independent hospital in San Francisco, Chinese Hospital has experienced numerous ups and downs. In 2024, Chinese Hospital was honored by Newsweek as one of America's best in-state hospitals for 2024. According to the Center for Medicare and Medi-Cal Services, Chinese Hospital ranks among the top acute care hospitals in San Francisco, having been awarded a 4-star rating.
We're still building other specialty care with UCSF so we can better serve our community. And we greatly appreciate Assemblyman Filtine for advocating the $10 million to support Chinese Hospital and to renovate the 79 building so we can build the subacute unit too.
As the curtains fall on our journey throughout the heart of San Francisco's Chinatown and the hallowed halls of Chinese Hospital, we're reminded of the indomitable spirit of the community that has weathered storms of adversity with grace and unity. For over 125 years, Chinese Hospital has stood as a beacon of hope, not just as a medical institution, but as a testament of resilience, compassion, and unwavering dedication of those who walk its corridors. In the faces of its caregivers, the stories of its patients, and the legacy of its founders, we find a profound narrative of cultural strength, communal support, and healthcare that transcends barriers. This documentary, while capturing a moment in time, speaks to the timeless value that Chinese Hospital embodies, ensuring that its legacy will continue to inspire and heal for generations to come.
You want to take care of people, and that's why you go into this.
It's important for us to prioritize investments in healthcare infrastructure and healthcare staffing.
我希望將來佢哋會喺呢一種精神發揚，會係三藩市嘅模範醫院。我可能睇唔到，但我期望佢哋。
我希望多個兒科同埋產科，不過我三胎啦，唔介咗你啦。但係我希望其他個家庭可以享受到你哋個服務咯。
We don't have to be big, but we have to have the quality, and we have to have something that all the Chinese are very proud to use.
Jen, the CEO, does a wonderful job as a good leader. So 我會繼續支持呢個東華醫院。
Went through up and downs. It has been really rocky, right, for Chinese hospital to be still here today.
What people don't know is this is the last community hospital that exists in San Francisco. It is the only linguistically and culturally competent hospital, and it is under endless, tremendous financial pressure. And if there's one thing the pandemic taught us, it is the importance of Chinese hospital. And we must remember that lesson and make sure that this hospital and its various outpatient facilities not only survives and gets by, but thrives.